Good afternoon, everyone. I'm Chris Brown, your state senator, and I want to welcome you to today's coronavirus update. I hope all of you are doing well, and I'm joining you today as we have over the past 2 months because I believe it's important to try to get you as much information as we can while we're trying to work our way through this difficult time. Well, we're now at day 54. And if anyone out there believes that they know someone who may benefit from the information we will be providing, I'd ask you to please go ahead and hit the share button now. Also, I want to remind everybody, which most of you already know, we have a site on our Facebook page with Coronavirus Resource Center. And in that, it is continually updated, has all the information affecting our Atlantic County families. So please share that with people too who may have questions and concerns. Also, in terms of disseminating everything, I want to thank Scott Cronick and WOND, our local radio station at 1400 AM on your dial. He will rebroadcast parts, if not all, of this conversation. So he's helping within our community to get answers to people's questions. Let them know that we care, we are here, and we're doing the best that we can. After my conversation today with our guest, I will provide some updates on a few important issues, so stay tuned for that. So one of the biggest things going on right now is the question about when are we going to reopen? So many are asking, and today we are very fortunate to have with us Michael Chait, the president of the Greater Atlantic City Chamber, who he, along with the committees and all the volunteers, work so hard to move our businesses forward, make sure that we have jobs for everybody. And I couldn't think of a better person to talk to us about Atlantic County, its plan, and what we're doing to be ready to reopen. So, Michael, good afternoon, and thank you for joining us. How are you doing today?
Good afternoon, Senator. Thank you so much for having me, and certainly thank you for everything that you do from a leadership perspective for the county and our area. Tremendous efforts by yourself and your team, and can't thank you enough for that. Myself, we're doing okay. I've never been busier from a chamber perspective and looking at legislation and talking to small businesses and trying to help them. Everything from funding to providing them with information on reopening documents. You know, the priority certainly on being safe and healthy as they bring employees back, as they start welcoming customers. Our tourism season is right around the corner, and we want to make sure that the business community is prepared to welcome them the best way that they can. Personally, it's very interesting teaching kids from home. I can tell you that. I have a 10-year-old and a 7-year-old. I'm very fortunate that my wife is a teacher at 4th grade. So it's a new world we live in. We're adjusting well, and we're going to be all right. We're all going to get through this together.
Yeah, I remember there was a point in time with all of my kids when they had homework questions. I had to hand it off to my wife, and she was the one who would provide the help. It is a different world that we're in right now, knowing that not only you're doing homework questions, you're actually trying to do it and be the teacher from homes. And I know so many Atlantic County families are doing such a great job, and commend them for it. So back to you. Thank you for being here. One of the first things under your leadership the Chamber did was to set up a Facebook community site to support our local businesses by alerting families that are out there, the different delivery options in Atlantic County. And first off, if somebody wanted to get information from the Chamber of Commerce and they were on Facebook, where would they go?
They can just simply search for the Greater Atlantic City Chamber on Facebook, on social media. They'll be able to see the group page there. The group page's name for the restaurants is the Atlantic County Takeout and Delivery Group. Right now, that group has 17,000 members. So it's been very humbling and a tremendous success that really has been a result of our community.
So I'm hearing you correctly. This program has been able to help many businesses here in Atlanta County navigate through this time?
It has, and we started the group on March 18th, 2 days after the executive order from Governor Murphy about closing the restaurants. And what we found that, focusing on the restaurant industry is, one, there's a tremendous amount of restaurants in our area that employ an incredible number of people. And at that time, it's difficult for them to keep their doors open when they were very limited with what they could do. You can't welcome people into your physical restaurant. You are only limited to take out and deliver. The page caught on very, very quickly as the community members just started sharing and posting information about restaurants, and you would gradually find more and more restaurants were sharing their menus.
And so now, go ahead. I apologize, but you have over 17,000 members who are part of that site.
That's correct. Since March 18th, wow. 17,000 members. What's even more incredible is there's been over 350,000 points of engagement. That's a post, comment, like, the thank you messages, from small bakeries, from produce locations, from ethnic restaurants that you've never heard of. And I think that's been what's really fascinating about this is the sharing of different restaurants. A lot of people are saying, I didn't even know this place existed. And now it's not just learning about these restaurants, it's keeping them open. So we are essentially buying food from them to put on our tables. And because we're doing that, we're putting food on their tables. We're keeping these people employed, we're keeping them working, and they deserve a tremendous amount of credit for how they're reinventing their business. Really unique packages, family-style takeout. Back Bay Ale Houses started doing takeouts for their mason jar drinks, and it's caught on like crazy. But it has been unbelievable.
So, in other words, I can order a drink online, or I have to drive up there. How does that work? I'm curious about this one.
They have takeout. They have packages. So, for example, even Tacos El Tío on Cinco de Mayo, we ordered dinner from there that night, and they had takeout margaritas. So it came with your alcohol and the mixed drink already made and fresh limes and salt. Wow. It's brilliant. And they did an unbelievable job. So you're seeing Linwood Country Club is doing that. It's just, they're being very, very creative for the customers.
So this looks like a site that would not just benefit the businesses, but our families as they're looking for something different to eat. I know the Atlanta County is just so great, and the families here are phenomenal. And one of the examples, as you pointed out, these businesses are sharing each other's menu and working together. A rising tide lifts all boats. But it sounds like even families who are looking for something different will benefit. Can you say one more time, or I'm going to ask the people working with me to post this in the comments section so that everyone can have access to it. But what is that Facebook site one more time?
Sure. It is the Atlantic County Takeout and Delivery Group.
That's great. That's great. Well, as everybody knows, unfortunately, other businesses have had to completely close their doors under Governor Murphy's executive order, which of course includes our casinos, which put 27,000 families out of work. And all of it, I agree with, was necessary in order to flatten the curve, to work together, to make sure that we put the health and safety of the families in Atlanta County and those that are vulnerable first. And one of the unforeseen problems, of course, has been the governor's office or the Department of Labor's handling of the unemployment, which has been a complete disaster. Families with no jobs and not getting money are forced to go to food lines, and businesses are struggling to hang on. And now tourist season is upon us. So while we understand and we totally agree that the data and the health of our Atlanta County families has to be priority number one, we also understand that there are common sense things that we can do and common sense ways we can begin to not only put together a plan, but put together a real timeline within which we start opening up businesses and doing it smartly and within the guidelines. And certainly here in Atlantic County, that is something that I know you and I have talked about continuously and trying to figure out how to do that. So let me just start with when do you think would be from what you've known of the data and what's going on, a time to open?
You know, I think you hit it on the head when you have to look at the data, and the safe and healthy reopening of businesses has to be priority. We couldn't agree with you more on that statement. But having said that, you know, there are some businesses that could open now and practice social distancing. Other states have implemented pickup and delivery options for retail. Maybe some things in your fishing industry, construction can start getting going again. There are industry segments that if you look at a gradual, safe, healthy reopening, that we can get some people back to work, gradually start to improve our economy as we prepare for the tourism season. You know, we, in conjunction with the NJBIA, worked with them, that's the New Jersey Business and Industry Association, did a survey in late April. That 70% of the businesses, and well over 1,000 were surveyed across the state, believed that they were able to open safely under CDC guidelines and social distancing right now. You know, the majority of those businesses, well over 80%, need more than 50% of their clients and customers just to break even. So if you're adhering to guidelines and they know that they have to reduce their capacity to bring in income and service their customers and clients, we have to take a real hard look at the best and safest practices to start reopening some of these businesses as soon as possible.
And I agree with you. And our focus is, and one of the things that both you and I have worked together is what is the data from Atlantic Care and Shore Medical Center. And we're going to get to that in a moment because that is crucial. That's going to dictate ICU beds, hospital beds, ventilators, testing ability, tracing capability. And within the county, I know that you and myself have been pushing others and trying to get that data so that we can do everything safely and smartly. And with that data, when you look at it, you know, our county executive had mentioned this, and I couldn't agree more when he said if CVS can sell Mother's Day cards, then Hallmark should be able to sell Mother's Day cards. And if Target can sell furniture, then why not let Kensington open and sell furniture? And if you can eat from a food truck, why not let golf courses have beverage carts? It's that common sense approach and having the confidence in the people here in Atlantic County, which I do. I start from the premise that they're smart, that they're loving, that the last thing they would ever want to do is cause anyone else to get sick. And if you set out the guidelines for them from the CDC, from the governor, and they give a plan within which they can comply, and we have robust testing and we have the trace capabilities, then we should be able to get things started. And most important is to have that plan and have it ready. So understanding that restarting our economy is not as easy as flicking on a switch, and that we want and need to make certain we follow the health metrics from the federal and state government, as make sure that we are prepared, because common sense seems to tell us, right? If you're going to slowly open, you may get a spike. So that's where the robust testing and the trace ability has to be in place. And we also have to make sure that our hospitals, whether it's Atlantic Care in Galloway or Atlantic City or Shore Memorial, have the capacity to deal with a spike. And so I know working together, you have been in touch, as have I, with Atlantic Care, Mainland, and the Atlantic City division, Shore Medical. From the data that they've provided to you, in terms of care and testing? Are they ready and capable of handling where we are at, and if we were to do a gradual opening?
It appears that they are, and give an incredible amount of credit to their teams and our frontline healthcare workers for what they're dealing with and what they're going to deal with for some time. Incredibly brave and committed people that are frontline workers that are running to the fires. They're telling us to stay back. It is unbelievable work that they're doing in this globally unprecedented situation. But in our conversations with them, as you have said, in our conversations with Shore and Atlanticare, they have not maxed out. They believe that it has stabilized to some point in our marketplace. They haven't kind of come over the hill yet, but it is stabilized, and they do have capacity to handle if there is any surge, which is critical. We look at potentially reopening and then seeing a surge. The last thing we want to do is overwhelm our healthcare system, and with their ability to communicate with Shore and Atlanticare, and even they're working with Cape May Regional to share PPE, to discuss ICUs, to discuss ventilators on hand. Right now, they're in a great position, and hopefully coming over that curve, they're ready to handle anything. So they do have capacity to expand. They need more ICU beds. Currently, they're only, Atlanticare is only using about 30% of their ventilators on hand.
Well,
these are all good signs.
I know that we forwarded you, and I don't have them in front of me right now. Maybe Tom in my office can bring them, but I know that we forwarded you the actual data from both Shore Memorial and Atlanticare, and I think that's important as a reassuring thing for the people in Atlantic County to hear and understand that now is not the time to be half-cocked. Now is the time to be deliberate, to be thoughtful, and to understand that we're dealing with the health and welfare of our people who live and breathe and work here in Atlantic County, and that we are doing our homework. Would you be able to tell us some of those stats?
Yeah, so I just had Atlanticare's questions up on the screen, but of course, working from home, sometimes it freezes, of course.
So I know I asked Tom. I'll ask him again. I know he can hear me. If he could just bring me the statistics.
I'm pulling that up.
While you're looking.
Yeah, what they have now for Atlanticare, they have 26 ICU beds in the Atlantic City campus and 24 ICU beds on the mainland campus, and that's currently adequate capacity according to them. They have patient surge plan through which they could expand the number of ICU beds to 76. Their overall bed capacity, complete bed capacity, is 359 surgical beds. And this doesn't take into consideration the Atlantic City Convention Center, everything that's there as well.
All right, I just want everybody to know, Mike, we have Cracker Jack staff here, and we have these stats as well. Please continue.
Sure. So between the two campuses, as we mentioned with the ventilators, it's 30% of which are being used. I think you've got some really good data being showed. In the county right now, there's 1,533 cases of COVID that have been diagnosed. In the state, you're looking at 130, almost 140,000 cases. So Atlantic County has about 1% of the total cases across the state. We're in a good position because we're not as densely populated.
Well, one of the things that you're bringing up, I think, is a great point, and something that I've been expressing to the governor's office and trying as best I can. He still indicates he's taken a one-size-fits-all approach to how we open. And there are two main reasons, and it's really common sense, something that everybody who lives here certainly understands, and we're different than North Jersey. Number one, you just made a great point that the number of cases and the capacity that we're able to deal with, we've been fortunately, God was good to us. We have been much less hit than North Jersey. Atlantic County and Salem County and Cape May County are night and day from Bergen County. So certainly there's the reality that there are some openings that we could do under the CDC guidelines down here that you may want to wait a little longer in Bergen County. And number two is we are a seasonal economy. We're different than North Jersey. We, families, businesses, depend heavily upon those tourist seasons, whether it's June through September, if you can push it May through October. But the bottom line is it's definitely more Memorial Day to Labor Day. And we have to do everything we can to continue to try to educate the governor, let him know that we are different, that one size doesn't fit all, and that depending on what his plans are for the whole state, we may be able to do things here in South Jersey that they can in North Jersey. And I understand that and I respect that. We're just hoping that he has the open-mindedness to realize that our situation is much, much different than North Jersey. And is that something that you would agree with and something that you're working towards in the chamber?
We are, and we definitely agree with that. This is not a cookie cutter plan, although, as you said, the guidelines from the CDC, the FDA, OSHA, they're consistent across any application, industry, business, association, etc. Those guidelines will work across the board. However, when you start looking at things like the spread of COVID, population density, economy scale, and industry, you have to take those variables into consideration for each area. Even in our area, just in Atlantic County alone, Atlantic City is very different than Hamilton. So there may be, even on a hyper-local level, where you're able to implement some things to gradually start opening up. And a good point of this is, if you look at Atlantic County, we have about 400 people per square mile. And you mentioned Bergen County. Bergen County has 3,700 people per square mile.
Yeah.
Middlesex has 2,600 people per square mile. This is one time where, you look at South Jersey, and we should be looked at very, very differently from a density standpoint, and also the economy we have, as it is a tourism-driven economy. We have a lot of open space that we can effectively utilize safely and healthy. As you said from the beginning of the conversation, it has to be safe, it has to be healthy, and the businesses are preparing themselves for that messaging and the preparation with their workforce and to invite their customers in.
Yeah, I think you make great points. And presently, I know that Ken Hauser, the head of the Mayors Association, is someone I've been speaking with, and I know that he's working with the mayors throughout Atlantic County. And one of the things that we recognize through the leadership is that while North Jersey is different than South Jersey, each municipality within Atlantic County is different. Certainly Port Republic is different than Atlantic City, and Northfield is different than Brigantine, and so on. And so working with the mayors is a very important piece of the puzzle. What efforts are currently going on with you and, to your knowledge, to develop an Atlantic County specific plan?
Well, I think working with our elected officials like yourself, talking with our freeholders, talking with our county executive and mayors on an elected official level is an ongoing process. Every Friday, we talk with organizations like the Biggs Landing Merchants Association, Margate Business Association, Somers Point Business Association, the ACEA, to get input from those different municipalities. What is the business community experiencing there, and how can we help? Our board is 60 members strong, so we rely on a lot of them for input and decision-making processes on what the chamber does. On a state level, that will overlap into what we do here locally. We're part of the New Jersey Business Coalition. There's 80 different associations on this. We have a call twice a week with the governor's office, and we ask for a variety of different things, whether it's legislation, opening processes, as we've discussed. It's been very, very effective, but now you're taking that information, giving the governor good data providing you and other elected officials with good data on what we're seeing from the business community. Consistently working on those efforts and putting them into a document. The Atlantic County office released an reopening document last week. We're taking a look at that and trying to figure out how we can enhance and complement that with benchmarks and build in some dates, build in some recommendations for different industries and different practices. And in that, we're looking at a variety of different industry recommendations. We're certainly not the expert on every single thing, but what we're really good with is collaborating and bringing people together to help disseminate the best information we have.
Well, I can't thank you enough for your leadership within the chamber, and of course, all those board members and organizations and businesses and individuals who are dedicating their time, their money, their energy to help one another, help all of us reopen and find ways creatively, but smartly, and to make sure that we are following the health guidelines so that we can get people back to work. I know I've been talking with and working with through the Casino Association. Each casino is preparing their own individual plan. They're submitting it to the DGE. And there's even a legislative bill that's going to be discussed on Thursday for voting that has to do with finding ways to get the casino industry safely and within the health guidelines and responsibly open. Have you and your members, of course, have worked with them? Do you have any update on their plans or where they stand?
I have not. I have to call them this afternoon regarding legislation on that. I know that MGM put out a document yesterday that I haven't had a chance to go through, but I give the Casino Association a lot of credit for working with Atlantic Care and working with the local health officials in order to put together a safe and healthy plan. They're great casino operators and hotel operators and welcoming their guests, but give them a lot of credit for recognizing we're not the healthcare experts, so bring them to the table so this document's very cohesive and complete.
Yeah, I think that was obviously smart, but it's also what we would hope that leaders of the casino industry would do, and that is, while profit, of course, they're in business to make money, is important, the health, safety, and welfare of all the families from Atlantic County who work there. We're talking about 27,000 families who we need to make sure that they're going to be safe. And then you're talking about people coming in from around the world. And if we don't do it right, you could really put a strain on our healthcare providers. And I didn't mention this earlier, but I can tell you that every time I've reached out to Atlantic Care or Shore Memorial or asked any question, they have gotten right back. Their staff with the administration is phenomenal. And then, of course, the frontline people, as you said before, the doctors, the nurses, the aides, the staff, the people who clean the building, everybody who run into the fire and tell the rest of us to stay away, risking their health and being away from their families. The love that we have for them is phenomenal. And it's because of that love and that concern that we don't want to do anything that is going to cause them to be further in harm's way or strain our hospitals, strain our ICUs, strain our ventilators. But the data tells us there are areas that we can begin opening gradually and smartly. And from speaking with the people at Atlantic Care as well as Shore Memorial, we have been assured that if things are done smartly and following the CDC guidelines, we are in a position that we could begin to do that. And again, I know that one of the things that we've both been looking for is making sure that we have robust testing. And one of the questions when County Executive Levinson was on with us a couple weeks ago, he pointed out that Atlantic County already does contact testing. And he pointed out that in addition to that, the federal government, along with Governor Murphy, are hiring and adding more people. So in other words, with the robust testing and the contact tracing abilities and following the CDC guidelines, there are smart and effective ways that we can start to reopen our economy here in Atlantic County. And is that the message that you've been talking about and trying to get out?
Yes, absolutely. I think that the data, the testing is very, very critical as we move forward. And I was happy to hear that yesterday during some of the federal testimony given that we could essentially increase testing to about 50 million people a month across the country by the fall. I mean, with 328 million people in the country, and you can implement 50 million tests a month by the fall is unbelievable how we could do that. So in theory, you could test everybody over a period of a few months, which would be phenomenal. But that testing and the tracing will be very, very important as we gradually reopen, the business community and open up some of the recreational opportunities, so we can be aware if there is a surge, and then potentially scale back if we have to. But I think that if we're taking all the proper protocols, what the CDC says, what OSHA says, that there's our healthcare system is a good place to handle a surge. Exactly what you said, that we're putting ourselves in the best position possible to have a safe and healthy reopening.
Yes, and I think the biggest word is responsible and thoughtful, and making sure that everything we do with the understanding that we're talking about human lives. And even if you compound that, the reality is, and we all understand, if there were to be a spike and we had to shut back down, that would do twice the harm. So I can't thank you enough for your research and working with me to get the data from the hospitals, get the data on our ventilators, get the data on our ICU beds, get the data on the hospital beds, so that the approach to opening, whatever it may be, will strictly be based upon the science and the data, but the understanding that we are different down here in South Jersey than they are in North Jersey, and that we are a seasonal economy, and it's devastating to so many families that they're out of work. And then of course, with unemployment being a horror show, and they're waiting on their benefits, it just compounds it. So let me ask you this: what will businesses need to do in order to open and operating while protecting the health of their employees and customers? Like, for example, what protocols are there that you're aware of for casinos?
Well, when you look at casinos and you look at their overall, it's not going to look the way it used to look. The casinos are taking into consideration every possible precautionary measure that you can possibly think of. Everything from changing room keys to a mobile device to eliminate contacting, to plexiglass in certain situations and areas, limiting the number of people that are going to be in elevators, eliminating valet parking. You're not going to see entertainment and large banquets for a period of time. So it is a gradual reopening. And, table games aren't going to have maybe every third seat. Slot machines, they all won't be open. They'll be spaced out. So what they're trying to do, and similar to other businesses, is practice the CDC guidelines for social distancing. That's 6 feet apart. And they're also looking at how they're cleaning everything and taking proper protocols to disinfect and keep their employees and their guests safe. And then you have PPE, all of the protection equipment that their guests will wear. Your dealers, your security staff, your front desk personnel, they're going to be wearing masks likely as we go forward to prevent that spread of COVID. So there are a lot of protocols, as you can imagine, in enormous properties like that do so many different things. But they're practicing and putting all of those in place now.
And what about for example, restaurants and bars? What are some of the things that you've been working with them to put a plan in place?
The National Restaurant Association actually put out a fantastic document on how there's reopening guidance for these restaurants. You're looking at using outdoor space more often if possible. It gives us an opportunity to look at our municipalities and maybe change some variances to give them more outdoor space. They're looking at the safety for food. Their employees wearing gloves or masks. Obviously, with any restaurant, cleaning, sanitization. I think what's important for all of these employers to implement is keeping their employees home if they feel ill for any reason, and then also checking them as they come in. Do you have a temperature? How do you feel?
You can do that forehead temperature test, and it's quick, and there should be nobody who has an issue with that, right?
No, there really shouldn't. I know that police departments and fire departments have implemented that since day one. So before you go in to, say, a firehouse, they check your temperature. Halfway through your shift, they check it again. Now, temperature is not always completely accurate. You can take ibuprofen, but I think there's a lot of self-awareness here about how you feel and what you can do. And something that we haven't talked a lot about for everyone is to be healthy, exercise, diet, etc. Some of this comes back on us.
You say diet, and that being at home, every time I walk by the refrigerator, I find myself eating something. So I understand what you're saying, but we also have to be realistic. So you're saying if you're going to eat more food because you're stuck at home, try to make it healthy food.
Yeah.
I understand.
Best to get out, take a walk, get some fresh air. Moving around, so a bike ride is safe. Walk through some of the beautiful parks that we have here in Atlantic County.
Sure.
Practice social distancing, but that's all good for us, especially the mental side of everything.
Yeah, I couldn't agree more. Get out, and even if you go visit your parents or your grandparents, stay outside. But you have that glass door. Just talk to one another through the door. Or you stay in the backyard and they stay by the door. But yeah, get out, visit people, talk with people, using all the guidelines, the mask and the social distancing is very important. One of the things when you talk about businesses, Mr. Donofo is a friend of mine. He's somebody who's invested, of course, in the Northfield movie theater, and he's somebody who is in the process of rehabbing the Ventnor movie theater. And the job they did in Northfield is phenomenal. That whole complex there is just wonderful. And they are being very prudent. I know that they are in the process of coming up with a plan and to let them reopen their theater in Northfield. And if they can reopen it in a way that's safe and meets CDC guidelines, certainly it seems to me that that's another thing that we can afford our families a chance within the guidelines to go to a movie or to get out of the house or to do something. While at the same time, here's a guy who's invested thousands upon hundreds of thousands of dollars and of all the times to shut them down because, that mortgage keeps coming, those bills keep coming, everything keeps coming at you, but you have absolutely zero income, especially coming up on the summer. And another example is he was doing that limited construction in Ventnor, but Governor Murphy shut down even the partial construction. And that's an example of something that certainly if there's a construction crew and there's nobody at the site, the men and women who are working can certainly follow guidelines to make sure that they're social distancing and keep the construction moving forward and work with businesses like the Donofos who are trying to build and rehab the Ventnor Theater, but already have the Northfield one that they've invested thousands of dollars in. And have you spoken with them or have you worked with that type of a business that you're trying to see how they can formulate a plan?
Yeah, well, I've talked a lot with John Henderson from Good Time Tricycle about events. Anything where you have a large number of people in a contained environment. What does that look like going forward? I've talked to Live Nation, certainly the casinos. We run the air show, so there's challenges with that. That's probably the hardest segment to practice social distancing because the environment itself encourages large crowds.
Right.
So you do have some challenges, but again, we're working on finding solutions to overcome that. What does it look like? How do you take care of your employees, practice social distancing, following the guidelines, preparing the workplace and the environment by keeping it clean, customer engagement, everything from, even your vendor engagement and controlling access into your place. If you don't know these people, what can you do? Signage in the businesses, consistent communication, and making your employees and customers feel comfortable by coming in because you are being safe. So there's a lot that goes into these conversations, but that one in particular that you bring up certainly has some unique challenges that some of our other business industries do not.
And what about things like charter fishing boats? Certainly that sounds like something that we could be able to follow CDC guidelines and let that business, even though right now it's deemed non-essential, something that could, under the circumstances right now, reopen. Is that right?
It is. And as you said that just today, the Virginia put out a really good document that I've got to take a look at on how you can implement social distancing on charter boats based on the size of the boat and how many people have access on it. Because if you think about it, the people that are going charter fishing are likely coming there in the same car.
Yeah, it's a family.
Yeah, they're good friends. They've been around each other, and they're coming on the boat. Now, if the charter boat captain and his mate are comfortable with that, they have the size and the capacity on a boat, absolutely.
And again, that's just another example. Michael, as we come to a close, is there anything else that you would like to say or point out that you believe could be helpful to our families here in Atlantic County and our businesses?
I think that, what we're doing and what you're doing and the collaboration that you're seeing today, it's almost like the social distancing has brought us closer together as a community. You're seeing a lot of great things.
I can tell you I've been trapped at home with my 3 children, and nobody's killed each other yet. So we have been brought closer together.
It is bringing back some of the traditions that maybe were lost because we work so much, or we run and take our kids to soccer and baseball and swimming, etc. But sitting down and having a family dinner at night has been great. There's some silver linings that have come out through this, how businesses can be more efficient. Certainly talked to some attorneys that do their depositions by Zoom, and it's saving them a tremendous amount of time. So I think what you'll see is that because of great challenge gives us great opportunity. And because we're collaborating and coming closer together, that we're all going to get through this together under leadership that you provide and our other elected officials. So I certainly want to thank you for everything that you do, all of our essential employees for everything they do, and the community as a whole for hanging in there. These are tough times, but we're tough people. And there's no quit, and we're going to get through this together. And the healthcare workers out there, just unbelievable with the first responders. You hear a lot of the stories. I hear some of them. It is incredible of what they deal with. But I think that collectively, we keep collaborating, we keep working together, we keep sharing good data, we wash our hands, we follow the right process, and we'll be back to a new normal sooner than later.
Well, I don't even like the new normal. We'll be back to normal. We're going to get through this. We've been through worse. It is certainly challenging. And while you're still here, I do want to let all the people, 27,000 families who count on the casinos for their job, that I have been working with Senator Sweeney in trying to not just talk to the governor about the differences between South Jersey and North Jersey and finding ways to get us back open, but I've been reaching across the aisle, rolling up my sleeves and working with my friends in the Democrat Party to make sure that we are doing everything we can so that the casinos can reopen, not just physically through making sure that each one has a plan with this gaming enforcement, but that each one also is financially able, whether it's through loans or otherwise, to be able to take the hit, the millions and millions of dollars that they have been losing, and get back up on their feet so they can employ our families and our families can get back to work. I want to thank you, Michael. Anything else you'd like to say?
No, I think if everybody that's watching and listening to us, we're here for the Greater Atlantic City Chamber to help you with any of your business needs. you have any questions, call us at 609-345-4524 at any time with any questions. We are happy to help. And Senator, thank you so much for giving us the great opportunity to come on and speak with you again. We always look forward to working with you. Again, thank you so much for everything that you do.
Well, Michael, you are the best. Your leadership with the Chamber and all the members of the Chamber of Commerce, the Greater AC Chamber of Commerce, who dedicate their time and energy just to better Atlantic County, and so that the businesses function, do well, can hire people and are here and expand our economy. I want to thank you for that very much. We're going to put the phone number up in the comments section, and all the information that Michael has relayed, which will include some of the numbers and some of the plans that are in place. Thank you again, Michael, and I hope you have a blessed day.
Thank you. You too, Senator. You take care. Be well.
Yes, sir. So now what I'd like to do is share with you some updates, and one of the things that's on everybody's mind, and we now have over 1,200 active cases that we're trying to help families is with unemployment or unemployment benefits. And so please remember, I not only want to, we are helping everyone who calls, emails, smoke signals. People are finding all different ways to reach out to us and ask for help. Sometimes we have a limited staff. We're not set up as the unemployment office. In fact, that falls under Governor Murphy and it falls under the Department of Labor. But we have a responsibility and obligation to do everything we can to help you, and we are. So if you call and it's busy, or you call and you leave a voice message, please make sure, obviously, you leave your phone number, but also leave your email address. We have gotten back to everyone that has left their phone number or email address, and we will continue to do so. As I told you, we have over 1,200 open cases. Whether it's the phone calls we're making, explaining on how to answer the questions on the line, explaining to keep up with your emails, because the Department of Labor will email you information, help explain it to you, and most important, to let you know that somebody in government cares, that somebody in government understands that this is one of the times we're needed, not necessarily passing all the bad laws that are passed in Trenton, but to be here to listen to you, to understand that you are valuable, you should be treated with dignity and respect, and we are here to work with you. Ironically, there are plenty of people who live outside of Atlantic County. I guess word got out that there is an office that is working overtime, 12-hour days, trying to make sure we're getting back and helping people. So there are a lot of people outside of Atlantic County who are now contacting us. Listen, I want to help everybody. I have an obligation to everybody in this state, but my heart and my first obligation are the people of Atlantic County. And right now we are overwhelmed and inundated. I've been blessed. Not only do I have wonderful people working with me, but we have volunteers. And if anybody wants to volunteer, we can coach them on how to answer the unemployment questions, on what we can do to help somebody who calls. And we have volunteers now who are helping us to reach back out to people, to get through to the unemployment office, to reply to emails with helpful information. And so if there's anybody who would like to volunteer, we certainly would welcome you and your help. Along with this, one of the things I said from the beginning, and this was Senator Sweeney who first brought it up, to his credit, when the governor first gave stay-at-home orders to so many of our state workers, in a bipartisan way, was suggested that you should take those workers who are now home, and so many of them with virtually nothing to do, and cross-assign them and train them for unemployment, so that unemployment can actually get back to people, and you don't have senators' offices from the legislative branch trying to do the executive branch's work, and so that people can have faith in their government and believe it works. So one of the things that a bill that I'm sponsoring will authorize state workers from other departments to be reassigned to help processing unemployment claims. And I know that so many of you have exhausted your benefits and you need the 13-week extension. According to the Department of Labor, it expects to begin issuing unemployment benefit extensions on May 18th. That information is something we are going to put in the comments section so that if you didn't catch all of it or you didn't write it down, it will be there for you to go back to. And so you know, yes, I have asked the Department of Labor for a more specific and more solid answer. But at this moment, unemployment benefit extensions should begin May 18th. So now moving on to testing. Right now, Atlantic County is obviously still doing testing through the leadership of Mayor Small. Atlantic City is also doing testing. I'm going to talk about Atlantic County right now. They are currently taking appointments, and the next available date is Thursday, May 14th, this week behind the Hamilton Mall from 10 to 1 p.m. I will put that information in the comments section. County residents who are symptomatic and have a doctor's prescription may make an appointment at www.atlantic-county.org/COVID/. If you do not have internet access, you may call 609-7700 extension 4381. And again, we're going to put that in the comments section. As we talked about before, one of the things that I have been emphasizing and pushing for and working with our county executive and our freeholder board and all of the mayors and all the parties at this point, clearly, and obviously it should never matter, but it definitely doesn't matter right now. We are all hands on deck working together. And one of those things is for a robust testing and tracing system, which is part of the federal and state guidelines for us to reopen in the first place. So right now, there are basically 3 types of COVID tests: nasal and throat swabs and saliva, which, by the way, the saliva test was developed by Rutgers University. Now I graduated Rutgers. My oldest son graduated Rutgers. My middle son is graduating Rutgers, and my daughter is entering as a junior to Rutgers. So a big shout out to Rutgers and the great state of New Jersey for being first. The state's goal, of course, is 90% of all positives to be notified within 24 hours. Currently, there are 135 public and privately operated specimen collection sites statewide. In addition, there are 11 Rite Aid locations in the state. CVS will have swab and send testing capabilities at 50 of their stores across New Jersey by the end of the month. Those locations we will post in the comments section. The governor announced great news yesterday, and I commend the governor. The governor went to the White House. He met with our president. They shook hands. Well, maybe they bumped elbows. I think they were both tested, so they were able to do that. But they practiced social distancing. But the understanding that now is certainly not a time to be partisan one way or the other, in that we all need to work together. And through that, and through the governor's efforts and his stick-to-itiveness, New Jersey will double its testing capacity and increase to at least 20,000 tests per day by the end of May. This capacity will be built out moving forward with a minimum of 25,000 tests completed per day by the end of June. And that's exactly the type of testing that we need to be safe and make sure everyone is healthy and protected. The state is obviously prioritizing testing for vulnerable population, including our friends and family and long-term care facilities and developmental centers. The state testing program also ensures ready access for frontline healthcare workers, first responders, and transit workers. And through that work with the governor, with the president of the United States, the federal government has provided, and that's also with the work of our Congressman Jeff Van Drew, 750,000 swab kits and 500,000 test kits with contact tracing. As County Executive Levinson shared with us earlier, Atlantic County already has a robust tracing system. Now, New Jersey plans to hire an additional 1,000 people to help trace cases, to work with our local, county, and regional health departments. This is in addition to the 800 already doing the job. And I share privacy concerns many of you have about tracing. However, I have been assured that when it comes to tracing, your privacy will be protected. If you test positive, your name will be kept private. And that is paramount in order for people to trust the system and to enable us to be able to go out and trace back who they've been in contact with. Also, as all of you, I am eager to see more antibody testing tomorrow on a bill that I am co-sponsoring. This will permit families to undergo COVID antibody testing as may be approved by the FDA. That will include even at-home testing kits. Now, we all know these blood tests can play a critical role in the fight against COVID-19 by helping our healthcare professionals identify individuals who may have been exposed to COVID and may have developed an immune response. In the future, this may be used to help determine, together, of course, with other clinical data, whether these individuals are immune or less susceptible to the infection. Tomorrow, an update on the voting session. One of the bills that I have put forward would be to establish the Hospitality Emergency Loan Program in the EDA. And the bill will provide no interest loans up to $10,000 per business per month to qualified small hospitality businesses like restaurants and breweries, amusement and recreational venues. Now, these are the small businesses that are the backbone of our tourism industry. And we're not talking about a bailout, we're talking about a plan where you loan them money over a short period of time and they pay it back, but giving them the ability to earn money so that they can reopen, that they can function, they can pay their employees, and we do have an economy to come back to. I also want to take a moment to thank Lauren Moore and all his team at the Atlantic County Economic Alliance. All of them are doing a phenomenal job assisting our local businesses who are applying for federal, SBA, and NJEDA loans and grants. I am going to post the Atlantic County Alliance information in the comments center. Again, I want to thank Lauren Moore. I want to thank all the volunteers on that board, the county for the work that they're doing. I encourage all of our businesses to call 609-245-0019 if you need assistance. And as with everything we do, we wish to you to stay safe, be healthy, be smart, love each other, understanding that this will end and that we are making great progress, that the hope is there. And I know, and I have so much confidence and belief and faith in the great Atlantic County spirit and our families that loving each other and working together, we're going to get through this. We've once again tried to give you as much information as we possibly can. We have our Facebook page, which has the COVID Resource Center, which has all Atlantic County driven information. I have my office, my staff, myself, working 12, 14 hours a day, trying to help with unemployment issues and just with daily questions everybody has. So please stay well. Thank you, and God bless.